Transplantation. Organ transplantation is a modern treatment that aims to replace affected organs or tissues with organs, parts of organs or healthy tissues. The graft may be transferred, transplant, from one section to another in the body, or from a donor to another human, or from animals to humans. Organ transplantation operations that are performed today are kidney transplantation, liver, pancreas, intestine, heart, lungs, bone marrow, pancreatic cells, skin, cornea, and bones. Organ transplantation is a very complicated and difficult process, but it is considered the best way to treat failure career for a specific member. The transplant treatment increases the patient's life and improves his quality of life. The protection system in the human body against dangerous pollutants treats the bait as a foreign body, and within a short period of time the immune reaction is activated, which leads to rejection of the bait. Acquired immunity to graft depends on the adaptive system between tissues, which is made up of 400 different proteins that are represented by white blood cells. When there is a perfect fit between the transplanted organ and the recipient body, as occurs in identical twins, the graft is received successfully. In fact, since the system is so diverse, the chances of a donor and recipient matching are very slim. This lack of adaptation causes the transplant rejection system to be activated, and as a result, the graft reception does not succeed. The rejection system can be overcome by chronic use of drugs that suppress the immune system. These medications prevent the body from rejecting the taste and increase the likelihood that the taste will survive longer. The routine medications that are used, such as corticosteroid, leukoplakia inhibitors, calcineurin inhibitors, and multiclonal antibodies, have proven effective in the success of the transplant, but they are not specialized only in treating graft rejection but also harm the body's immunity against infection and malignant diseases. Infection complications are especially common a year after the transplant, and the most common of these infections is caused by cytomegalovirus. The monoclonal antibodies that are provided to the organisms with the routine treatment will lead to tolerance, that is, the proper functioning of the transplanted organ even after the immune system suppressing drug has been permanently stopped. The multiplicity of drugs intended for the treatment of rejection provides the possibility of adapting the drug to each patient individually and moving from one treatment protocol to another when the suppression of the immune system is insufficient or when the side effects of these drugs appear. Very severe rejection occurs immediately after surgery, when the receiving body has antibodies to the donor blood type or acquired antibodies against the transplanted tissue from birth. This severe rejection can be prevented by matching the lymphocytes of the donor and the blood serum from the recipient. The acute rejection process usually occurs several months after transplantation and is characterized by a decrease in the performance of the transplanted organ, and general inflammatory symptoms, which were called rejection disease in the past. In the long term, recurrence of primary disease in the original organ or reduced blood flow to the transplanted organ due to blockage of small blood vessels and/or chronic rejection are the main causes of loss of taste. Transplant surgery is characterized by the implementation of certain procedures in order to reduce the period of blood disconnection from the organ that must be transplanted, and this period starts from stopping the blood supply to the organ, transferring it to the medical center in which the patient is most suitable to receive this organ, and until the time this organ reaches the patient's blood circulation. Preserving the organ through controlled cooling and supplying it with specially prepared fluids to prevent the formation of cell edema in this organ and prevent the formation of free elements in this organ as well, and this limits the damage to the organ as a result of the temporary lack of blood flow to it. Since then, surgical techniques have improved, the time of the organ outside the body has been shortened, and treatments that suppress the immune system have developed, and although in general there is no perfect fit between tissues, the percentage of this type of surgery, especially kidney transplantation, has reached a high success rate until this surgery has become surgery is considered routine from a medical point of view. According to religious beliefs, an organ donation out of free will is a sign of love for others and love for help. Nevertheless, there are ethical considerations because there are risks, even though they are small, for the donor as well, and because of the pressure he faces from society. Organs such as the heart or liver that need regular blood flow until the moment of their extraction for transplantation, are taken from patients who suffer from damage. Their brainstem is incurable but their heart is still beating yet. In the 80s, the decision was accepted that if someone's brainstem death was diagnosed, that means they are truly dead. This enables medicine to exploit the vital organs of the dead body with the consent of his family, and this procedure is based on the lack of respiratory function as the determining factor. However, the community finds a solution to these complex ethical issues regarding the donation process based on religious, cultural, legal, and social considerations. Despite the increasing public awareness about donating organs for transplantation, there is still a huge gap between the number of donors and the hundreds of thousands of patients waiting for transplantation in the world. Is based on the lack of respiratory function as the determining factor. However, the community finds a solution to these complex ethical issues regarding the donation process based on religious, cultural, legal, and social considerations. Despite the increasing public awareness about donating organs for transplantation, there is still a huge gap between the number of donors and the hundreds of thousands of patients waiting for transplantation in the world.